You're watching News 3 Now at 6.
Just last week, the U.S. House of Representatives passed the Trump administration's budget proposal. It included $4.5 trillion in tax cuts. An analysis by the nonpartisan Congressional Budget Office says the plan cannot be reached without reducing spending on Medicaid. And that clashes with commitments from Republicans who say they won't touch the program. Sarah introduces us to members of the local disabled community who are in fear over what's next. Sarah?
That's right, Eric. These are just some of the Faces of Medicaid, which serves more than 1 million people in Wisconsin. If the Senate and House agree on the plan, the House Energy and Commerce Committee will have to find $800 billion in savings, a number that's impossible to reach without slashing Medicaid. Now, we're talking about 1 in 3 children, 55% of nursing home residents, and almost half of disabled residents in the Badger State. 35-year-old Tyler Engel was born with spinal muscular atrophy.
My hand, the other one.
Oh,
Yeah.
so.
His arms are slowly getting weaker.
Yeah, my elbow forward more.
In a wheelchair since the age of 3, Tyler has been independent since 18 and has quite the resume. He has degrees in physics and mechanical engineering and is currently working as a researcher studying respite care and the caregiver crisis, not to mention knitting as a hobby.
I'm working on a sweater right now, too.
Tyler admits he's on edge due to the possibility of cuts to Medicaid.
It's always been in the back of my mind, but it's been in the front of my mind lately, yeah.
He relies on Medicaid for health care and caregivers and is especially frustrated by the president's suggestions of waste and fraud.
We're not going to touch it. Now, we are going to look for fraud.
Show me what it is.
Tyler's own research shows Medicaid has some of the lowest rates of fraud in the country.
Let's start with CIA or even the senators. How much fraud and waste do they have on their end?
We invited Tyler and a panel of others representing the disabled community to dig deeper.
Medicaid is a shared resource.
Patty Becker's son, Will, uses a Medicaid waiver in order to keep his job at the Hy-Vee in Oregon. Patty is also the director of program operations at Community Living Alliance, a nonprofit that helps those with disabilities.
Right now, for someone to live in one of our state centers is $45,000 a month. For somebody to receive community-based supports through IRIS or family care is $4,500 a month. There isn't physical capacity for everyone to physically move somewhere, right, where they're going to stay, as well as that income or that cost to us as taxpayers will dramatically increase.
I enjoy staying busy.
29-year-old Lily Giroux has epilepsy and cognitive disabilities due to her seizures. Her mom, Ann, explains how Medicaid allows Lily to live independently, using a job coach, and to keep her on track at the Hy-Vee store in Madison.
The alternative is perhaps a facility, a long-term care facility, or 24-hour care, or going to the ER more often. That's more expensive than this preventative care that's what Medicaid is.
And then there's Krijan Olson, a researcher in healthcare access who has cerebral palsy herself and whose teenage daughter also uses a Medicaid waiver. And all of these families have to prove they need Medicaid every year.
Someone comes to our home annually and does an evaluation that's extensive, reviews all of her educational and medical records.
We asked if Medicaid doesn't cover services, where do they go?
The local hospitals. We just lost a couple hospitals in the Chippewa Valley area in Wisconsin. It has a big impact. People are traveling 2 hours to get mental health care because they don't have a hospital offering it. And this is all part of the continued ripple effects of having a deep cut in Medicaid.
And it's hard to see the consequences until it's too late.
You think about with the pandemic when all people stopped shopping, they stopped going out, they stopped eating. This could have a similar effect on local communities. Because if we're doing community-based stuff really well, you don't notice it, right? And then that's good. Which is hard when it comes to these moments for all of us, because you can see the pothole.
Yeah, oh, big time.
You won't see Tyler at home alone in his apartment. That's what will happen if there's no one to help him get out and get to work.
Despite Tyler's fear about his future, he continues to fight for his care every year, as long as it exists.
I lose my home, I lose my job, I have to live with my parents. Who knows, probably end up getting sick, and it could easily cost me my life.
As you can see, there is a lot of fear and uncertainty out there, and not just for those in the disabled community. And there is understandable confusion over the numbers as well, Eric.
And you can see why. Always a lot of back and forth going on in Washington. What's next in this budget process?
Well, as we talked about, you and I, Senate Republicans have pushed through their own budget framework earlier. So now the two chambers will work on a common plan to the president, but he has signaled that he supports this House plan we've talked about over the Senate one.
Good story, Sarah. We will stay tuned.